good morning, and welcome to The Big Show and The Big Show TV. It's Glenn, Angel, Adhd, Shaun, and Dr. Geraldine Tan from the therapy room.
Yay!
Good morning, Jerry.
Good morning.
So what is this? I hear you have ADHD.
Oh, wow.
No, she doesn't.
Get to the point, why don't you?
What kind of question is that?
I don't know. Sean told me that.
No, today's...
I just received the notes. Just
Well, it is
moment ago.
our topic for the
That is
day.
the topic.
Oh.
Yes, it's the topic.
Clearly, Glenn can't focus either. All right, so
It's ADHD.
My camera is not focusing as well.
Your
Yeah,
camera-
I'm
yeah.
orange.
you
Yeah,
are
I know.
What's going on?
too much on the sunbed.
I think so.
Just hit it on the side. Hit it on the side.
Today's topic is ADHD and tips for exams. But before we get into that, Jerry, I want to ask this. We've dealt with this ADHD kids going to normal schools because it is a condition. And I just want to ask so that I have it straight in my mind. Who decides that an ADHD kid can go to goes to a school? Is there a test they have to take? Do the parents decide? Does a therapist decide? Who decides that this child is able to go into a mainstream school?
You know, all the schools, all the children in Singapore are entitled to go into a mainstream school.
Okay.
So all children go into the mainstream school. It is only when the parent, the educator figures out that there is something wrong with the child, or there is a limitation, they're struggling, they're having challenges, that they highlight to the parent to say, hey, maybe you need to get this child checked out or tested because the child is having too much difficulties catching up.
Okay, but some parents, before the child goes into school, already knows the child has ADHD.
Yep.
Then how?
Yep. So we don't typically test them so young. We can, but we typically don't. So the average age is about 6 to 7 years old. Yeah.
And are there different sort of levels of ADHD?
And what is ADHD for the people who are hearing this for the very first time?
That is so true. He is paying attention.
Finally!
And his camera is back.
Yeah.
Thank you.
Yes. I think it's the camera. ADHD, attention deficit hyperactivity disorder. So the very lay person explanation would be the person or the child that is unable to focus, concentrate, and presents with inattentive or hyperactive behaviors, or both.
You know what? I'm not just saying this to get everyone's attention, but I really do think I have ADHD. No, really. But I was never diagnosed.
Do you need help? We know of a therapist.
But can you find out if I really do have ADHD? And I really do mean that, because when I was in school, right, I found it so hard to focus, so hard to concentrate.
I think a lot of us did, though. I did as well. I was like, I mean, every time it was in the report book, right? Has potential, but lacks focus.
Yes.
Jerry,
And if you read the fine print, it has potential, lacks focus, may become a DJ.
Talks a lot.
Talks a lot.
Can't stop
No,
talking, yeah.
It is. Okay, there are 3 different types of ADHD. So I've described it, very globally. There is the restless, impulsive type. Okay. So those are the types that you would see, they fidget a lot, they run around, they are talking nonstop, they're very disruptive, poor impulse control. Then there's the other type that is inattentive, where they are your dreamers, they space out, you talk to them and then they seem to drift away and suddenly they go, huh?
Yeah.
Oh,
okay.
right.
the space cadets.
Space good.
And then there's the combined presentation. That means both of the symptoms that we talk about.
Okay.
Oh, wow.
Okay.
Features.
Okay.
Yep.
Okay, let's continue to talk about this on The Big Show TV. Meantime, here's Craig.
So, Dr. Jerry, I have 2 questions for you. Firstly, what is the percentage of people who are affected by ADHD? And secondly, what causes ADHD?
Okay, the percentage. So US has a really high number. Okay, and they report up to like 1 in 5 children in the classroom.
Wow,
that
that's
is
really high.
reported.
That's like 20%.
I wouldn't be surprised if that's the number here in Singapore as well.
Is that the number here?
It's lower in Singapore. It's lower in Singapore. Yeah, but I don't have. I was trying to look for the numbers, but I don't have the numbers in Singapore. But the last that was kind of discussed. So it's not reported. Last that was kind of discussed is about 1 in 7 or 8 children.
Oh, that's still quite high
Still
then.
high though.
Yeah.
And what causes ADHD?
It is a neurological condition.
Okay.
It can be genetic. Yeah, because sometimes if your parents are, the tendency for the children are. So my poor kids.
So your mother cannot
you're
snap it out of you.
You have ADHD?
I don't know. But I self-diagnose, right? Because I will tell you, about the symptoms. I mean, we can share about it later on. But so let's go into some of the symptoms, right? So I have an absolutely messy table. Whoever that comes into my room will always notice my messy table.
Okay.
Yes. Yeah. So
that it?
children, no. So children that find it very difficult to organize. So they have messy files, messy bags, messy tables, They have a pencil case and they love their pens and colors and everything. But their whole pencil case is just stuffed with full of things.
That was me.
That's
Right?
Yeah. I was
Yeah,
like,
me too.
But you're very neat. You like to
really?
organize. Yeah, you
No,
are
actually,
very
I
neat.
don't
his wife taught him how to be neat.
So there is a cure. Okay.
cure.
So messiness, difficult to organize. What else?
say they would be like losing wallets, losing water
Oh,
bottles, coming back.
Sean.
me again.
The restlessness. So they would be they can't sit still. They have to get up, they have to do something. If they're seated, their legs are moving. If their legs don't move, their hands are moving, they're tapping something, twirling something, so very fidgety, very restless. So those would does any
No,
so parents are
I like how FD is like sitting there trying to be as still as possible.
Yeah.
That's not me.
No, because I always have to have something in my
Yeah, same.
hands. I can't be without anything in my hands.
I'm none of these things. Okay, the next.
Picking all the boxes.
interrupting people. like you-
Interrupting.
Yeah.
That's what I do.
yeah. So they can't wait for like someone to finish the sentence. They will finish their sentences.
That's all of us.
Jerry is going like, okay, and I know, which one of you, right, displays this trait every week on the show.
I think that would be all of us.
Yeah, a super talkative. So on the report card, the teacher always would write talkative.
I never had talkative in my report card or my report book. Never.
I was so bad. My teacher made a rubber stamp and just instead of writing, just put it.
Careless mistakes, often missing out like details. You read, but you don't read the details. Like you miss out certain vital information sometimes. You read it globally. You don't read it in with the fine print.
Right. Okay. Is ADHD something that's only noticed in children? I mean, can it appear in adults later on in life?
So, diagnosing adults has been really just very, very recent because most of the time it is a childhood disorder and we would diagnose it for the children when they are in school where it's most troublesome for them. But more and more adults, because of their readings, because of their awareness, have been coming forward, which is wonderful because they are realizing that, hey, but I am having an issue. So more and more we have.
It's true. Do you want to see me soon, Jerry?
Again.
I love how he weaves it in every week.
I know, right? But more and more adults are coming forward, and you'll be surprised. These are like people in position of power coming to say, I'm so frustrated, I'm just like, wanting to tear my hair out. They might have the messy tables, they might not be losing a lot of like their water bottles and wallets anymore, but they find it difficult to organize and structure other things. So we have university students coming in saying that I feel very lost, I cannot do my work. And you wonder why they can't do, because university work is not as structured as secondary school or JC. Yeah, so they cannot cope with the lack of structure. When they're left to their own devices, they don't have a template.
So they need to work within sort of a skeleton at least of what needs to be done.
Yep. And imagine the brain, right, has no filter. So, over the years, we would learn how to have a filter. What are the important things, what are not the important things. But very often, especially for the little ones, they say, but everything is important. Or you look at their notes, they highlight everything. And they say, I don't know which is the important point.
No.
And they have to be taught how to extract the important points.
Okay,
Wow.
okay. So coming back, I want to ask you about the challenges that kids face.
Okay, stand by.
In 3.
We're talking about ADHD this morning and how you can cope with exams as well. That's something that we'll be touching on a little later on.
Yeah. But Dr. Jerry, on the Big Show TV, you were talking about how ADHD, do you call them patients?
Well, they are just people.
Okay.
Yeah.
I would say victims. I think victims.
Victims, yeah.
People with ADHD, you were talking about how they have no filter and how they can't really separate what's important and what's not important. So what other kinds of challenges do children or adults living with ADHD face?
So the lack of structure, they find it very hard to sieve through. So the adults, this is very interesting. They find it very hard to sieve through an email. So I had one, actually not just one, a couple of people coming to me saying, I can't read my email. I don't know why I can't read my emails. And you know how some people send long emails?
Yeah.
Please do not send me long emails, but beautifully crafted emails with perfect English, and you have like 5 paragraphs.
Yeah.
Which you have to plow through. Now, people with ADHD look at that whole screen or that whole page of black and white, and they go, it's black and white. I cannot make sense. So there was this, these 2 people came and say, I can't read my email. I said, what's going on? And they say, how do I sieve through everything? Remember, they have no filter, right? So then we realized, they only needed the points. So they were leading teams. So what we needed to get them to do was to tell their team members to just send them in point form what is required.
Okay.
Or to summarize a meeting into the more pertinent points. And that worked beautifully for them.
Which pretty much should be every email,
Exactly.
right? I mean, like it's not a storytelling session.
Yeah, but a lot of people don't know that.
If I see anything long, I'm too tired to read it. Boom, that's it. I delete it.
More than 3 lines each time.
That's us here. But there are people that take pride in their email and write beautiful narratives, in their storytelling.
Yeah.
And it's actually really nice if you read, you have the time and the energy. But when you are, on the go and you are feeling stressed and pressured in the workspace, then your brain has no time to sift through everything.
Okay, so what about labels that children have living with ADHD? What are the labels out there?
Let's see if anybody identifies with this. So because they're so misunderstood, they're called stupid. You're so stupid. How come you can't do this? Or you're so lazy. Can you buck up or not?
Yeah.
You're not trying hard enough. The last week we already gone through. Or because you're interrupting so much. You're so rude.
Yeah.
Yeah, or someone will call out, or the teacher, stop daydreaming.
Yeah.
So yeah, labels like these, but they don't recognize the frustration the child is going through.
But how do you separate a child that really is, say, can't be bothered from one that has ADHD? I mean, like when we were growing up, it was all just, oh, you're lazy, you're not smart, you're daydreaming,
Yeah.
this and that. But today it is, you are labeled as having ADHD. Where's the separation?
The child with ADHD, the adult with ADHD actually do try. They do try very hard. And they feel very demoralized each time they are called lazy, each time they are called stupid, because it's not that they are not trying, and they feel very hard done by because I'm so misunderstood. I'm trying, and you call me names.
So would Dennis the Menace have had ADHD? Or was he just naughty?
He was a menace.
I think he has ODD. I don't know. I'm
ODD?
What's the-
ODD?
Oppositional defiance disorder.
Oh, defiance.
something new we've learned today?
Yeah, ODD.
ODD,
I
wow.
don't know. He just looks so naughty.
Yeah.
I mean, it must take a really creative scriptwriter and producer to create that story. So kudos to them. But he's quite naughty.
Probably
I love
loosely
Dennis the
based on
Menace.
himself.
The one with
yeah.
Walter Matthau.
And,
Yeah.
and,
Yeah.
and, with
And I
the
also
red
love
and
Problem
black.
Child with John Ritter.
Problem
Yes.
child.
Oh man, Problem Child. Yeah.
I don't know.
ODD as
Now
well,
I
I
need to
You
guess.
probably
watch it.
relate to these kids, that's why.
A little bit.
Yeah, that's
a little
why.
bit.
Okay.
All right, we are speaking to Dr. Geraldine Tan from the therapy room right here on The Big Show. Up next, Shaun Mendes with Mercy on 1FM 91.3.
So, Jerry, you have this disruptive child in a class.
Yep.
And you say perhaps your child needs to be checked to see if your child has ADHD. The child goes, and I take it they take some kind of test,
Yes.
right?
Yes.
And they are found to have ADHD. Then what? Do they go back into the normal stream school? What? What do you mean?
Yes, they do. Yes,
But
they
then,
do.
are the teachers then trained to handle this?
I think more and more the teachers are now learning about the different learning disorders. Yeah, and the resources are out there. We are very willing to partner them and work with them as to how to help the children, because every child presents with different behavioral manifestation or different needs. Yeah, and different severity also. So that's what the testing helps us. It helps us to distinguish what type of presentation they have, as well as how severe it is.
Okay, so speaking of testing, tomorrow is the 1st of September, which means exams are just around the corner.
Yep.
How do kids with ADHD deal with exams? And would you perhaps have any tips on how parents or kids can,
Yeah.
make it a little bit easier, not as frustrating?
Memorize everything.
Memorize everything.
Okay,
Make it into
before
a
we
story.
even-
Spot questions.
Hiyo, is that how you learn? from
Because,
your-
I mean, as an ADHD guy, I mean, that's what I did.
He self-diagnosed
He
himself.
self-diagnosed himself.
I think before we even jump into that, right, I think I want to highlight that these children are very intelligent. They have, they can have average intelligence or even above average intelligence. And if, all of you on screen today, diagnose yourself with ADHD, I can say that all of you are very, very intelligent and
Thank
have
you.
found
Oh.
ways to compensate. So, first thing that we do is not the next thing after we diagnose the child, we focus on their strengths.
Okay.
We want to find out their strengths, because it's very sad to diagnose somebody with ADHD and say, here's your label, you're all bad, and because of this label you cannot function.
Yeah.
So that's why I think FD is asking, can the child go back to
Yeah.
the mainstream?
Yeah,
No,
which I
of
didn't
course the
understand
child-
what FD is asking, because, I mean, they're not...
They're not autistic.
they're not.
they're
they're
not
actually
autistic.
normal, but...
But the reason why I'm asking that is I see them as having a problem. So is there a special system used for them?
So a very severe level of ADHD.
Yeah, where
perhaps.
they're completely disruptive.
So
you
they have
know,
to be in a different institution.
type.
a
of-
different system.
Is there such a thing?
Okay, if they're extremely disruptive and have other comorbidities, perhaps it might not be suitable for them to be in the mainstream education system or the local one.
But this would be ODD, like you mentioned earlier on, right?
Not necessarily. So comorbid can comorbid with many different things, right? So they can comorbid with. So the autistic child can also have ADHD.
Okay.
The dyslexic child can also have ADHD. So it can come together. The different sort of like mood disorders, personality disorders can also have ADHD.
Okay.
Yeah. So it can come in combination, and I guess when it is a bit too severe for them to be in a certain environment, then they are taken away from the environment. Otherwise, we all learn how to cope with the mainstream environment.
Okay.
Yeah. So we don't typically take the ADHD child out of the mainstream education, but some of the because of their personalities, some of the children do flourish in perhaps an international school environment where the learning styles are different, where the studies is presented differently. They can cope in a different way.
That's interesting.
You were saying that when someone is diagnosed with ADHD, you try to work on their strengths. How does this help a child prepare for exams?
So they have one thing that I love to search: hyper focus.
Oh wow, okay.
Yes. So I think most of us can identify, like when we are in the zone, when we're doing, so they have that, and sometimes it's multiplied by 10.
Wow.
So when they're in the zone, don't disturb them, because everything else gets blocked out, or they get very, very irritable because they need to just complete this task. But it comes in bursts. So it doesn't come like, it's not all the time. So it may be like for maybe for a younger child, 5 minutes, and you just capitalize on that 5 minutes. For an adult, it can come in like for periods of time, days, weeks.
Wow.
Yeah. So when they do projects, they are amazing. So they complete one project after another project, but the daily mundane grind gets to them.
Can ADHD individuals control when they hyper focus? Can they get into that zone on their own? Can they control that?
They can help themselves be aware when it might occur.
Yeah.
Right.
And take a step back. That's I think one way to control.
But they want to
Because
hyper focus.
I think I do that. I hyper focus quite a bit. I'm serious. I'm not kidding.
No, yeah, he's pretty serious.
But
on
the
this.
only way for me to control that is if I take a step.
But it's good to
back.
hyper focus, right?
Not really. I think they've seen me hyper focus before on the show.
Don't know whether yours is hyper focus or overthinking.
That could be it as well. So for example, gamers. I mean, hyper focusing for
Coders.
gamers and coders and people working with tech or even like, as you said, maybe architects, artists, and stuff like that. That would be a plus point for them.
Yep.
Okay.
So it's that, which is why it's not a bad thing. A lot of people think that ADHD is bad, but sometimes it's very functional. So a CEO, a leader that is that has ADHD may be very disorganized. You need to get someone that is organized, that can kind of pick up the pieces and structure things for you, but can be very creative. And, when on a project, really focusing on that project and just take the entire team to greater heights. So it's really fun.
It's interesting that you said leaders that have ADHD. So I just looked it up. So people like Bill Gates, Walt Disney, Richard Branson.
My Donald Trump, don't forget.
IKEA founder as well.
Yes.
Jim Carrey.
Donald Trump.
No, Donald Trump doesn't
No,
have
he doesn't.
ADHD.
We can talk a
He
little
just
bit
has
about this.
small
I think it's
hands.
quite interesting. Okay. Good morning. Today we're touching on attention deficit hyperactivity disorder, or ADHD. We are speaking to Dr. Geraldine Tan from the therapy room. Good morning, Jerry, once again.
Morning.
Good morning. And Dr. Jerry, earlier you were talking about how what's it called? Hyper-focusing? Hyper-focus from ADHD individuals can be a good thing. And I've just looked up some leaders, world leaders that have ADHD. People like Bill Gates, Walt Disney, Richard Branson, the IKEA founder and chairman, and more recently from the Olympics, Simone Biles, Michael Phelps. From the entertainment industry, people like Justin Timberlake, Will.i.am, Adam Levine, Howie Mandel, as well as Jim Carrey.
And don't forget Donald Trump.
No, I don't think Donald Trump has ADHD.
Oh.
Yeah.
He only has
no
small
focus.
hands.
Yeah, he has no focus.
Hey.
But you're saying like all these world leaders and famous people have learned to take their what we may see as a weakness and turn it into a positive enhancement of their lives, and things that they can turn into something great.
Yep. So they have learned how to use ADHD to their advantage. And these people are very intelligent. They can be geniuses. A lot of them are very creative, and the ADHD helps them to just really fantasize and think about they really bring that code, the sky is the limit. They just really, bring that notion out.
But you see, I think all these people kind of struck it out on their own at some point, because if you are working in an organization and you have ADHD, you might not go down very well, let's say, with your bosses, for example. So you're talking about that creative streak and all that. The only way for them to do their own thing is if they're
Go
on
down
their own
path, right? Yeah.
You know what I mean? Because if not, I think it's very hard for them to survive in an
To work for
organization that perhaps doesn't understand where they're coming from.
Yeah. I know someone who has a child with ADHD, and my question is, I want to go back. This kid is 11, about 11. How does a parent help that child prep for the exams in school? Because I know that's always been an issue for them.
Okay. So now it's almost the examination. So I'm targeting now right at this point in time, right? So one of the things that a teen actually told me is, can I have some audio space? And I was like, what in the world is audio space? Can they stop nagging me or not?
So some quiet time.
Yeah.
No. They don't really need quiet.
You don't want to be nagged at.
Because it just drones on and on and on, and it cuts through everything. Every time they are getting into the zone, the parents nag them.
Right.
And
Okay.
Honestly, as parents, we don't know when they're getting into the zone and when they are studying or when they need the break.
Yep.
And the teens always say, my parents have a knack of coming in when I'm taking a break and when I'm on my phone. But I already studied and I need to take a break.
Right.
So I don't know. I think it's something with teens and parents. And I laughed when, my son turned teen this year and became a teen this year, because apparently I was doing that all the time also.
I think parents just need to chill out and just leave their kids alone. For someone who doesn't have kids, if
It's
I had
easy
kids,
for you to say,
this is
yeah.
what I'll do.
No.
I'm like, okay, fine, just do your best and study hard. If not, you won't be able to find a good job in future.
What's the masculine term
And if
for tiger mom? Is there such a thing?
I have no
That's what
idea.
Glenn will
Very
be.
good
That's what Glenn will
question.
be. But like the overachiever, and you always have to study, and you got to do
think-
like everything.
you think I'll be like that?
Yes,
Yeah,
absolutely.
absolutely.
But I'm saying that I'm going to be chilled out.
No, not happening.
okay,
No.
never.
Yeah.
I don't know what is it called, but I'm saying it's no point nagging instead. And interestingly, the kids it's not that they don't want the parents there. They just want the parents to do things differently. It could be like just cooking for them. It could be like accompanying them, chatting with them. So ask your children what they need from you during this period of time.
Positive reinforcement, probably.
Well, what kind of reinforcement are you thinking of, FD?
Okay, hold that thought.
We'll come back. When I say, Jerry, as I mentioned just now, positive reinforcement, I'm talking about things like, hey, it's really good to see you getting down to your books. You're doing really well. That kind of thing, as opposed to, why aren't you on your books?
But remember, the parents keep finding them not studying. So that's where the stress is. So I always see this dichotomy, right? Like the kids coming in and say, can you get my parents off my back? I am studying. The parents saying, but I don't see them studying.
But I guess it shows in the results, right? I mean, if a child comes back with lackluster results, then the parents are going to be always on their case. But if the child is really doing well or doing as well as they can, then the parents kind of take a step back and go, okay, the kid is doing something right.
But I tend to disagree with that, Angel, because you come back with lackluster results. All your child can do is the best your child can do.
I guess so, but
you know what I'm trying to say?
But perhaps the parents know that they're capable of so much more.
Yeah, the problem is the parents want them to be capable of so much more, and their excuse is, I know you can do more.
I don't know. Dr. Jerry, the therapist in the room?
Oh, I struggled with that for a long time. And, in the beginning of my career, yes, I went with the results. Then I realized, but if we are telling our children that they are not their results, why are we still emphasizing on the results? Because if a child is truly having difficulties, then the results will show that they are having difficulties and not because they did not study.
Yes.
But the parents tend to then only focus, oh, see, I told you to study and you didn't study. And the child is like, feeling so vindicated, right? Like I did study, I was taking a break and you blame me for it, but I scored what I scored. But I really put in effort. So if you're thinking that, and this is what they do because they're very impulsive, if you think that I don't put in effort, sure, I won't put in effort the next time. And they kind of like they would take revenge. Hi, Julian. We want to ask whether you have ADHD or not.
What was the question again?
Do you have ADHD? Because we've established that quite a number of us here have ADHD.
Yeah.
I have ADHD, I think.
I think all the boys have.
I don't know. It depends. What's some of the symptoms, or
You can go back and watch the video.
Are you disorganized? Do you always lose things? Can you not sit still? Do you always interrupt people? Are you super talkative? And do you make careless mistakes?
No, I don't.
He's normal.
You're normal.
I'm very organized. I talk a lot. I think Yes, I don't.
You don't lose things.
I don't know. Jerry, you gotta tell me. I don't know.
Not diagnosed. Okay, for everyone out there, right? Angels just gave a whole list of symptoms, but do not diagnose yourself based on that. Disclaimer.
Let me be your assistant, Jerry. I help you diagnose people. How about that?
We have the DSM that we use to diagnose. So I know every time Angel will ask me what is DSM, Diagnostic and Statistical Manual.
What makes you think I was going to ask you?
Because you always ask me.
Fine, I'll write it down.
I agree. Angel had that look in her eyes. I'm going to ask. What is the
DSM?
DSM, yes. Okay.
All right. Okay. Any final words, Jerry?
Yes. Since okay. Let's go with I almost dropped my phone.
See, Jerry and myself are the same, no?
That's one of the symptoms. That's one of the symptoms.
No, that's clumsy. That's being clumsy. Okay. Just 4 more things is ensuring the children have enough hydration, healthy meals. So the parents can definitely do that. Remember that junk food lowers your IQ.
Aha.
Oh my God, I love junk food.
Yeah, man.
High fat, high sugar, processed food. If you want your child to, be no. It's not.
We
not
hear
for the
this
short
every day,
term.
though. We hear this every day. Processed food, high sugar, high
Yeah.
fat.
Come on, don't let me be
but
the only one admitting
research
that I
has
like
been
junk
done.
food. Come on,
I
Effie.
love- I
Help me
love
out
junk-
here.
I'm a junk food
I
king.
There
love
you
junk
go,
food. I
thanks.
just don't eat a lot of it. There you go.
Okay, brain stimulation requires also your body to be activated, a balance. Okay, so don't just sit there and study, and don't just think that relaxation is playing games and watching Netflix. Get your body moving. So your body also needs that activity level. Okay. Late nights is actually a no, but a lot of kids love to study dead into the night, sleep for 2 hours, and then hop into the exam hall. Can you please not do that? Okay, and this is for the ADHD children. Learn, practice, and do. So you learn, practice, and do by breaking down your tasks, pacing yourself with a lot of movement breaks, and taking your breaks. Yeah, so you pace yourself by taking a lot of movement breaks.
Wow, there's so
sounds-
much,
but
so
no,
much
but
to remember.
It sounds like something we should all be doing.
You know, if I had a kid, I would send my kid to you, Jerry.
He just wants to
Okay.
get into your office. That's
Yes,
all it
I
is.
know.
He needs to have a child to get into your office. It's like,
Yes. Maybe when you have a child,
there
you
you
can come
go. Which means never.
in. We
Jerry,
were
is there a
saying-
discount? Is there a discount? Because I would love my daughter to take swim. I'm
See?
just gonna chuck her there.
Chuck her
I'm
in.
just gonna chuck her
You
there.
don't need
Dump
to
her there.
ask. Just bring your kid here. We'll be more than happy to have her
Oh.
and take her off. I think we'll be playing with her more and just letting you, have a
Have your
good time
time.
with your wife.
She's gonna drive you up the wall. Jerry.
Oh,
she's,
no.
she's gonna drive you up the wall.
We love kids here, so bring them here.
Yeah.
I'm sure that's not
Jerry's
okay,
Jerry's met the worst of the worst, sorry,
Yeah,
I'm
there
sure.
you go. Last words, Jerry.
Last words. Then I'll pass it over to Julian. So we were saying that Michael Phelps has ADHD,
Yeah,
right?
yeah.
And he said there will be obstacles, there will be doubters, there will be mistakes, but with hard work, there are no limits. So for everyone that is struggling out there, bear this in mind. There is no limits.
So that was his secret, Michael Phelps, multiple Olympic gold medalist. You need to have ADHD.
Focus.
I don't think you can buy ADHD
but-
off the shelf.
No, but then all the other, gold medalists and all that who are not multiple winners,
Yeah.
they all don't have
No, but
ADHD.
could it have been that Michael Phelps had ADHD and every time he hit that pool, he was in his zone? That's
Yeah.
what it was.
Are you seriously studying a conversation with me about this? Thank you very much, Jerry, for joining us
I'll see
today.
you next week. Bye-bye.
See you, Jerry.
Bye.